Okay, so welcome to today's talk. So, I want to talk to you today about a kind of epidemic for today's generation for women. And I want to talk to you about this polycystic ovarian syndrome. This kind of hormonal disease that almost one in every five women from the age of 15 till the age of 50 have this so commonly. So, what is this polycystic ovarian syndrome? First, let's try to understand. Somewhere it's one of the most commonest hormonal disease to have happened in females, and it's like a taboo because the only thing that it actually shows is that you're going to put on a lot of weight, you're going to have facial hair, you're going to get a lot of hair on especially on here, on your side locks. You're going to have irregular menses. So if you're going to have irregular menses for more than 3, 4, 5, 6 months, and you're putting on weight, and there is a central obesity, and there is a hair distribution, and you feel depressed, you could be actually suffering from PCOD. It's one of the commonest cause of infertility, and if PCOD is going to be happening, you could have diabetes in future, you could have a heart disease, you could have a cancer in future. So what is PCOS actually? Irregular menses, weight issues, you could often have a discoloration in the skin, you start becoming darker. But the main thing where the problem is not actually this disease. It's what I often see is that they become very depressed, as if they feel very low because your appearance is affected. So there are some questions that I constantly get. What is PCOD? Is it so common? How do I know if I have PCOD? So one of the easiest thing for you to do would be you could get a sonography done, ultrasonography of your abdomen, and if it shows cysts, which is very common, if it correlates with your irregular menses and your facial hair and your acne is another very common, and you're putting on weight, you could have PCOS. If you have acne, does it mean you have PCOS? Not necessarily, but very common. If it has connection with your periods, it is possible. Are there any medicines to get PCOD better? Now, this is a very interesting question because in allopathy, there is no treatment for PCOS. There is one portable medicine that they give. They give metformin very often. They give you like an artificial medicine by which you get an irregular artificial menses, but they are not actually real. So there is no treatment for PCOD in allopathy. They often give contraceptive pills. And if PCOD doesn't get better, you're going to have a lot of problems in future, right from diabetes, cholesterol, blood pressure, cancers. What is the solution? The solution is a lifestyle change, a change with relation to your diet, with relation to the way you think, with relation to how you live. And here, homeopathy has a huge role, humongous role, because homeopathy acts at a hormonal level, at a much deeper level, and it kind of corrects the hormones. I want to give you one very interesting case example that, we see a lot of PCOD cases in homeopathy, and the percentage is just very good. It takes time. It often takes anywhere between 6 months to 1 year, but the change and the result is remarkable. It's natural. I want to give you this very interesting example. This is a case of a polycystic ovarian disease, 28-year-old woman. So she was not having periods for past 6 months, no periods. She's been taking estrogen pills. She came to know about this PCOS due to her putting on of weight. She was putting on a lot of weight. Suddenly, bloating. She was having a lot of hair fall. Another very important cause, a lot of hair fall. She didn't feel like meeting anyone. She would feel like lonely all the time. Recurrent boils. And she had like 17 cysts in the ovary, often more than 6 millimeters. Huge ones. So in homeopathy, we try to understand the person in the disease. So I tried to ask her, Tell me, was there any stress previously? Because very often PCOD is connected to stress. She says that I had my friends and we were very, very close, but they kind of isolated me, and I felt a lot of letdown. I felt a lot of loneliness within me. And I feel obese. I'm putting on weight. I don't look good. I don't look attractive. So I don't feel appreciated. I want that people should look at me and keep looking at me and talking about me and talk good things about me, and I should wear all kinds of clothes. But I don't look good. That affects me. Then she spoke about her situation at home. She said, my parents don't love me. They don't care for me. I constantly feel this no love, no appreciation, no one with me. Even so, she's working in a corporate office. She says, my boss is very, very critical. And amount of work I do, I never get appreciated. And that affects me a lot. I want appreciation. I want someone to talk good about me. But no one does. And I feel let down, disappointed. I'm a very sensitive person, she says. She says, I want someone to understand me, someone who takes care of me, someone who gives me attention. Even if I go out for a party, I feel okay. But if someone doesn't give me attention or doesn't give me some kind of thing, someone has, I don't like the idea of being ignored, she says. So this is very interesting because PCOD and her menses is one thing. But if you go a little deeper and understand who she is, her main thing that comes out, her pattern is that of needs to be appreciated, needs to have someone with her, needs for affection, need to be different, or else feeling of loneliness, feeling of no one with her, strong feeling of need to be appreciated. So I found a very interesting remedy for her, and you can see her as if she's not appreciated and as if wants flattery. The remedy being the remedy palladium. Palladium is the remedy for the queen, the need for a nobility, a need for a kind of appreciation. This is a homeopathic remedy, a metal that I gave in 1M potency. And the remedy, I also made some changes in the diet. I also asked a woman to do a little bit of muscle toning. And it took about 6 months, and now 8 months and 1 year, and her menses became regular. Her cyst almost disappeared amazingly. No pain. She lost 6 kgs. I put her off night dinners and I reduced her diet. I put her on exercise, and remarkable. And no allopathic medication. Change of state in mind was remarkable. She, for the first time, she told me, I have accepted myself more. I'm more in tune with myself. I feel more calmer. This is the change that can happen with homeopathy, and only with homeopathy, and almost not with any other treatment. Because what allopathy does, it causes suppression, superficial. Homeopathy is at a much deeper level. Very often I ask for lifestyle change, changes in diet. I ask them to avoid milk and sugar in all forms. Often just the way of thinking we need to work at. Exercises and toning of muscles are very important in hormonal disease. But most importantly, to find the right homeopathic physician to give the right homeopathic remedy is the crux. So this is what I want to share with you. Find a good homeopathic physician for PCOD. And there are very good, many good homeopathic doctors all over India. And PCOD can be treated with homeopathy. So I want to encourage all of you to go for a homeopathic treatment for PCOD. You can write to me. This is my email ID. I often do Skype consultations, and I have my clinic in Bombay in Dadar. And I look forward for any queries.